Alright, so in this lecture we're going to cover the muscles in the shoulder and pectoral regions. So now we're going to go over the muscles of the shoulder joint. First an overview, there's two groups of muscles involved with moving the shoulder joint, the extrinsic and the intrinsic muscles. The extrinsic muscles we already went over in the spine section. They're the superficial and deep back muscles, and they originate from the spine and attach to the clavicle, scapula, and humerus. The intrinsic muscles, which is what we're going to go over here, they originate from the clavicle and the scapula and insert onto the humerus. And this includes the four rotator cuff muscles as well as some other muscles. All of the intrinsic muscles of the shoulder are innervated by the brachial plexus, except for the trapezius, which is innervated by the accessory nerve or spinal accessory nerve, cranial nerve 11. This is just a posterior view of the shoulder. This is an anterior view of the shoulder. This is some of the muscles involved, and we'll go through all of these over the next few slides. Now, just very briefly, the extrinsic muscles, your superficial back muscles involved, your trapezius, which is shown here, your latissimus dorsi, which is shown down here, levator scapulae, which is shown right here, and then you have your rhomboids, which is shown right here. And manually, what their function is to manipulate the scapula to assist with movements of the shoulder. Now, the intrinsic muscles. The intrinsic muscles, you could think of it as the Teres Major, the deltoid muscles, and then the four rotator cuff muscles. So first we'll talk with Teres Major. Teres Major is not a rotator cuff muscle, okay? We can show it right here, Teres Major. It originates, now here's another example. Remember we talked about rhomboid, major, minor. The major is always inferior to the minor when we have these groups of muscles. So the origin is the inferior angle of the scapula. So you can see the scapula, it's covered in muscle here like this. The inferior angle is right here. So it attaches from there, and then it inserts onto the intertubercular groove of the humerus. You can see here it kind of wraps around to the anterior surface of the humerus. We can't see it here in this diagram because this is a posterior view. Now the movement. If you remember, muscles contract, so they shorten. When they shorten, they pull stuff closer together. So what does that mean? It adducts the upper extremity, and it also medially rotates. Now, it's hard to kind of show this, so it's pulling from this direction, which is kind of, so it's going to pull this way, pull the humerus, rotate it that way, so which is medial rotation versus, because it doesn't come from, it doesn't wrap around the posterior aspect, it actually, as you can see here, it wraps around the anterior aspect. It'd be this, it's just like, pulling on a string. So it pulls that aspect of the humerus medially, just like this, okay? It's innervation, lower subscapular nerve, which is a branch off the brachial plexus. Deltoid muscle is this big muscle here. It has a couple attachment points. It's the lateral third of the clavicle. It's called the deltoid because the delta in the Greek alphabet looks like that, and so it's kind of triangular shaped. So that's why it's called the deltoid. It attaches from the lateral third of the clavicle, which you can see right here. And then it also attaches to the acromion and then posteriorly onto the spine of the scapula. It inserts onto the deltoid tuberosity, which is here. So if we show a humerus here like this, you have your tubercles here, kind of here and here. Deltoid tuberosity is this lateral bony projection on the humerus. And so like the deltoid comes down here and it attaches here. Now the main movement of the deltoid is abduction. It's full abduction. So the supraspinatus kind of initiates abduction. The deltoid is what brings it all the way, which enables you to fully abduct your upper extremity. Now it's broken down into three heads: the anterior head, the middle head, and the posterior head. First, we'll start with the anterior head, which is this portion right here. This head also, by itself, it flexes and medially rotates the arm. Okay, so again, muscles contract, it flexes, and then it also medially rotates, so rotates it inwards like that. Now the middle head, shown in here, this contracts. It's going to pull the upper extremity out that way. Posterior head, it's kind of hard to see here, but it's back here. This is going to extend because it's going to contract, and pull the upper extremity out that way posteriorly, and then it also can kind of pull it out that way, which would be lateral rotation of the arm. So the deltoid has a lot of functions. The major one that people think of is abduction. And for example, its innervation is the axillary. When you lose axillary innervation, you lose, the way you test it clinically is you lose abduction. But it also is, you want to be, it's more so for, not so much for your board exam. Board exam is just the big thing is abduction. if you're for an anatomy exam, you want to be aware of these because you could get, if you have a nitpicky test, you could get asked on some of this stuff. So the rotator cuff, the main player here, these are part of the intrinsic shoulder muscles. They originate from the scapula and insert onto the humeral head. This is a great picture of the rotator cuff. Really, if we could do a circle around the rotator cuff, I'd say this is the rotator cuff right here. Teres Minor, infraspinatus, supraspinatus, and then subscapularis is on the anterior part. It provides a significant amount of stability to the glenohumeral joint. That's the main function, is it helps stabilize it into the head of the humerus, into the glenoid fossa, as we say here. A good way to good acronym to remember is SITS. So S for supraspinatus, I for infraspinatus, T for teres minor, and then S for subscapularis. First, rotator cuff muscle, supraspinatus. So if we look at the spine of the scapula here, supraspinatus is here. Supra, superior to spinatus, spine. So superior to the spine. So supraspinous fossa of the scapula. So this bone, this depression in the posterior surface of the scapula is called the supraspinous fossa because it houses the origin of the supraspinatus muscle. It inserts onto the greater tuberosity shown here of the humerus. It does abduction to the first 15 degrees. So if you look, muscles contract like this. They help pull the upper extremity out. So first 15 degrees. So if we draw a little angle here, 15 degrees, first 15 degrees, deltoid takes care of the rest. So if deltoid is out, but supraspinatus is intact. So if you have deltoid, we'll go over a little clinical thing here. It's deltoid and then supraspinatus, okay? If deltoid is out, but you still have supraspinatus, you can still abduct to the first 15 degrees. You just can't go past. Versus if you lose supraspinatus and you still have deltoid is okay, you can't really abduct that as effectively because you need the supraspinatus really helps with that first 15 degrees. Innervation, suprascapular nerve. Suprascapular nerve runs in here. We'll talk about that in a little more detail in this section. And it's responsible for supraspinatus and infraspinatus. So here we go, infraspinatus. Again, here's that spine of the scapula. Below, infraspinous fossa of the scapula, which is, again, this just depression inferior to the spine, which is where infraspinatus originates. It inserts onto the greater tuberosity, as you can see here. What does it do? So it contracts, okay? So you want to think about these muscles. It's much easier than memorizing all these attachments and movements and all this other stuff. Just memorize. It's a lot easier to just think about it. So again, you have these attachments down. It all makes sense if you think about it in a logical way. So it originates from the infraspinous fossa. It attaches to the greater tuberosity of the humerus. It contracts, okay? It's going to shorten. When it contracts and shortens, it pulls. Which way is it going to pull? It's going to pull this way, which is going to laterally rotate the humerus, okay? So it laterally rotates it, pulls it out like this, okay? And if you go on a skeleton model, you can see this. You know, you can put a piece of tape there and pull on it just how this, and you can see the motion in action, okay? Innervation, suprascapular nerve. Teres minor, which is shown here. Superior lateral border of the scapula is where it originates. Again, it inserts on this greater tuberosity. Very similar to infraspinatus. If it contracts, it shortens, it's going to pull this way. Lateral rotation out this way. Axillary nerve. So axillary nerve is two things. Deltoid and teres minor, okay? So if you lose axillary nerve, you lose both of these. Subscapularis, so you can see it here. It's on the anterior portion of the scapula. Subscapular fossa. Insertion, lesser tuberosity. So here's the greater. Here's that long head of the biceps. Is a great picture of it. A long head of the biceps tendon running through that intertubercular groove. So that's the greater tuberosity on the outside there. This is the lesser here. It attaches onto the lesser tuberosity. Now the movement. So again, muscles contract. Muscles contract like this. They shorten. It's going to pull this way, so it's going to immediately rotate, and then adduction, pull it in like this, okay? Upper and lower subscapular nerves. Pretty easy. Those come off the brachial plexus. Now, we'll talk about the muscles of the pectoral region as well. These are the muscles of the pectoral region: Pectoralis Major, Minor, Serratus Anterior, and Subclavius. This is a good picture of the superficial layer of the pectoral region. So first, Pec Major, the origin, it's the medial half of the clavicle. So you can see here, we divide it in half. This half is deltoid. This half is Pectoralis Major. Also attaches on the sternum here. And then the superior 6 costal cartilage, which is just kind of underneath here. Where does it insert onto? Into that intertubercular groove that we talked a lot about of the humerus. Movement. Okay, so overall, the whole muscle together, it adducts and medially rotates. So if you think about it like this, muscle shortens, it contracts, it's going to pull the upper extremity in this way. Medial rotation, adduct like that. There's also a clavicular head and a sternocostal head. So first with the clavicular portion, which is up here, which attaches to the clavicle. This part, again, it contracts, it shortens. This part is going to flex the humerus, so flexes it at the shoulder joint. So we're going to flex up like this. That's flexion. The sternocostal head, so we have that here. This is this portion right here. And when it contracts, it helps extend the humerus. And then the innervation is the lateral and medial pectoral nerve, and we'll talk about those nerves and their spatial relationships in the nerve section of the shoulder. Pectoralis minor, so this is it. We've cut away Pec Major here. And when you're dissecting, you can cut Pec Major at one point or the other and kind of reflect it back to get this deeper view here. So it originates from the 3rd to 5th ribs. You can see that right here. It attaches inserts onto the coracoid process of the scapula. You can see that here. It stabilizes the scapula against the thoracic wall. So here it contracts. It helps pull the scapula onto the posterior aspect. Its innervation's medial pectoral. So medial pectoral does both Pec Major and Pec Minor. Okay, and then lateral pectoral only goes to Pec Major. So Pec Major is duly innervated. Serratus Anterior. This is this muscle right here, this kind of long, flat muscle. It has a lot of different attaches, ribs 1 through 8. So it goes all the way down here, and you can see that here. That's the origin. It inserts onto the vertebral border of the scapula. So it wraps around the rib cage and goes onto the vertebral or medial border. So it does not come out on the lateral side. It goes onto the medial side of the scapula. And what it does is it contracts. So you think about it, it's originating from the anterior portion of the rib cage, and then it's attaching to the medial aspect of the scapula. And when it contracts, it shortens, it pulls. So it's going to pull on the scapula and pull it forward. It's pulling from an anterior origin. So it's going to pull the scapula forward and upward, which is called protraction. Also, by doing this, by pulling the scapula tightly up against the rib cage, it stabilizes the scapula during overhead shoulder movement. So in order to reach ahead, so like if you're trying to grab something in like a kitchen cupboard above your head, you need that extra stabilization of the scapula to help reach above you, to help fully pull your upper extremity above your head. This is innervated by the long thoracic nerve, which is a nerve that comes off the brachial plexus and runs down the surface of the serratus anterior, and you'll see that in the lab when you dissect. Subclavius is this tiny little muscle here. This isn't too significant clinically, but just to be complete, we'll talk about it here. It's in the name. It originates from the first rib, which you can see here. It inserts onto the clavicle here. Its movement, it depresses the clavicle, so it contracts. It's going to pull the clavicle down, and then on the opposite side, it elevates the first rib. And then its innervation is nerve to subclavius, which is a nerve off the brachial plexus. And that wraps up our discussion of the muscles in the shoulder and pectoral regions.